Yes, Dr. Obeng.
Hello, Dr. Marfo Obeng. We are happy to have you on our channel. Today we want to have a little interaction with you to see what you do here at the hospital, and then you educate us a lot on mental health. But before we even get into it, can you let us know what you do at the hospital and your background, what your specialty?
Okay, I'm a psychiatrist, a specialist with the Ghana College of Physicians, and my function here is I'm the hospital director.
Okay.
So I have both administrative and clinical duties.
Okay. You have a lot of work to do. You mentioned that you're a psychiatrist.
Yes.
What do you do as a psychiatrist?
Okay, so a psychiatrist is a medical doctor who has specialized in mental health care delivery. So we are charged with the diagnosis and the management of mental health disorders. So you come to the hospital, we assess you, we come to a diagnosis, and then we form a management plan which will involve some medication and some non-medication interventions to help you get better.
Okay. We hear of psychiatrists, we hear of psychologists. Sometimes it creates some confusion in our minds.
Right.
Can you help us know the difference between the work of a psychiatrist and then a psychologist?
Okay. So a psychiatrist is a doctor who has specialized. So we are primarily concerned with mental illness or mental disorders and the treatment of mental illness and mental disorders. Psychology is the study of all phenomena of the mind. Anything to do with the mind is studied under psychology. So it's not necessarily illness.
Okay.
So there are things like social psychology, which looks at how we interact with each other and how our interactions affect us. There's industrial psychology. So none of these things have anything to do with illness. There's even sports psychology.
Okay. Okay. Now we just want to enter your field.
Okay.
Let's begin with mental illness. We want to understand what mental illness is. So please tell us, what is mental illness?
Okay. In order to understand mental illness, we need to understand what mental health is. So I'll start from there. So mental health, according to the WHO, it's a state of well-being in which an individual is able to realize their potential, cope with the normal stresses of life, work productively and fruitfully, and make a meaningful contribution to their society. Now, this sounds very simple, but it's a very high bar. At any point in time, depending on your workload, you might be having difficulty dealing with normal stresses. So, for example, you get home, your child does something very small, you find yourself shouting at your child. You're not coping with the normal stress of life. So it cannot be said that you are fully mentally healthy at that particular point in time. However, we can't yet say that you have a mental illness. By the point of mental illness, then you have a significant problem that is manifesting in your thought processes. So you can start thinking that some people want to harm you, or thinking that you are the greatest person on earth, or thinking that you will never succeed in life. It can be a problem with your mood. So you are happy, ecstatic, energetic for no reason, or you are very sad for either no reason, or your sadness is disproportionate to the reason that you have, or it can affect your behavior. So you see people walking in town, some of them don't have their clothes on, some are wearing dirty clothes. So these are the three areas that tend to be affected significantly when you have a mental illness.
Okay.
Yes.
Okay. I'm sure there are types.
There are several types.
Okay. Can you tell us some of them?
So I'll start with the commoner things that we tend to see. So you have anxiety disorders. So this is when somebody is feeling anxiety that is excess to requirements. So there's some anxiety that is necessary to help you function.
Okay.
When exams come, if you don't get anxious, you probably won't be able to read properly. But there's anxiety that is excessive, either in the extent of the anxiety or when you relate it to what the person is anxious about, it doesn't match up. So we have anxiety disorders like that. And then you have mood disorders. So here we have things like depression, where people are excessively sad. And then you have things like disorder we call mania, bipolar disorder, where the person is excessively happy and energetic, giving away their things, sharing money to people, that sort of thing. And you have psychotic disorders, so disorders like schizophrenia. Decent number of the people you see roaming on the streets would have this disorder. They are hearing voices, they are believing things that aren't true. But it's not all, in fact, it's not even most people with schizophrenia that end up on the street. There are a lot of them who don't get that sick and don't end up going that far. So it's a spectrum of presentations. You have disorders, you have eating disorders. So we have anorexia or bulimia, people who don't eat well because they think they are overweight, even though they are underweight, and some of them even throw up. We have sexual disorders. So there's some performance anxiety. There's some men in Ghana who are having difficulty either rising to the occasion or maintaining their vim in the occasion, and all of this can be from a mental health problem and not necessarily a problem with the equipment per se. But it's not something that is not talked about in Ghana, so people don't know that they probably need the help of a psychiatrist or a psychologist. There are more, but I'll leave it over here.
Now let me mention this one. I didn't hear you talk about. A lot of people mention that epilepsy is a mental illness.
Okay.
Can you educate us on that? Is it a mental illness one?
So epilepsy is not considered a mental illness. Epilepsy is the term we have for it's a neurological disorder. So the easiest way to try and explain this would be that it's a disorder of the brain and not the mind. So it's not how the person is thinking, it's not affecting the thoughts, it's not affecting the behavior, it's not affecting the mood. But there's too much electricity being produced in the brain at some point in time, which is resulting in the convulsion that you see. So it's a neurological disorder, so it can be treated by general physicians and not necessarily mental health workers. Historically, because of the challenges that people with epilepsy have faced as a result of their convulsions, they have been treated by mental health professionals in Ghana. But technically it's not a mental health disorder. However, epilepsy can lead to mental disorders. So if you have epilepsy and it's not properly managed, it damages the brain such that you can then start presenting with either psychotic symptoms, or even the functioning of your brain can be significantly reduced. But these tend to be complications of the epilepsy and not the epilepsy itself.
Oh, okay. You mentioned the types of mental illness. Are there some particular types that are common in Ghana?
Right. So this again is a bit complicated. Excuse me. So there is what is common in the community, and then there's what is common in the hospital. If Ghana is like every other population, then we know that what is happening most commonly in the community is anxiety disorders. Somebody who every time he has to stand in front of the class, he's scared. Somebody who's afraid of heights. Somebody who's afraid of snakes. Excessively afraid of snakes. There's a reasonable fear of snakes, but excessively afraid of snakes, excessively afraid of spiders. All of these people are suffering from anxiety disorders, but they tend not to come to the hospital. So we don't have data on them to say that this is the proportion we have in Ghana. But reasonably, that there are a lot of people who fit, and even just these small criteria that I've mentioned in the society. Also very common are mood disorders, depression. There's a lot of depression going on in Ghana that doesn't result in a person coming to the hospital. You find a lot of depressed men sitting in bars, a lot of depressed women, in church crying, or, not necessarily coming to the hospital. So we know that these people are in the community, and it's part of the reason why we like educating people about mental illness, so that they know that they have a problem that can be helped. Because sometimes they are suffering needlessly when they could be receiving treatment. And then you have substance use disorders. So particularly something like alcohol. There are a lot of people who are dependent on alcohol, who are just, roaming in town, sitting at bars. They don't necessarily come to the hospital, but you know that there's a lot of alcohol dependence there. But when it comes to the hospital, because of the perception that we've had historically in Ghana that it is the very sick people who come to the hospital. You know, when you are dirty and you are not wearing any clothes, that is when you come to the psychiatric hospital. So those are the people that tend to come, or those are people that tend to be identified. But it's a very small proportion of the people who need our help. You know, it's a very, very small proportion of the people who need our help that come like that. So that will be the people with schizophrenia, like I mentioned earlier, very severe depression, and bipolar disorder. So these are the people we typically see. And then some substance use disorder, so cannabis, alcohol, some cigarettes. But again, this is a very small proportion of the people who should be coming to the hospital who do need help.
Okay. From what you are saying, I think after this interview, I would have to see you, because you spoke about the fact that people who fear snakes so much, and I see myself in that circle.
You know, the snake on the TV crying.
It's serious. I remember one time I had to just run away. I left the ladies there. One thing we really want to know is what causes it. So please tell us, what are some of the things that increase the risk of someone getting mental illness?
Okay. It's important to understand that a good proportion of the people who get mental illness, they tend to have what we call a genetic predisposition. That's to say, they were born with some genes that made it more likely that they will get a mental illness. Now, to understand this, you have to look at a condition like hypertension or diabetes. So, like, there are some people, they have hypertension in their family, diabetes in their family. It doesn't guarantee you that you'll get hypertension or diabetes. But if you hit the age of 35, thereabouts, you stand a higher chance than the next person to get hypertension or diabetes. That's the kind of genetics we are talking about. It is not a guarantee that you will get the mental illness. Sometimes you can't even find a father or a mother who has a mental illness, but the way their genes mixed in the individual left them with a predisposition to a mental illness. And then there are other things like your psychological makeup. Some people's psychological makeup is such that they are more anxious than others. You know, some of these people, something happens and their mind has already gone to the worst possible scenario. We are going to be in trouble, or they'll come and catch us, or that sort of thing. That can predispose you to a specific kind of mental illness, particularly the depression and anxiety side. And then childhood experiences. So childhood abuse can increase your risk of developing some mental illnesses. And the way you are socialized growing up, you can be socialized in a way that builds what we call your resilience. You are able to cope with stress well by the nature of your socialization, and then you can be socialized in a way that does not build resilience, in which case you have an increased likelihood of developing some mental disorders. But I have to be very clear about this. There's no hard and fast rule, because mental disorders are a broad church. There are a lot of illnesses. There are some that is almost entirely the genes that are causing, and there's some that are more influenced by some of these things I'm talking about. So it depends on the mental disorder, really.
So that means if someone doesn't even have any genes that predisposes the person can still
develop. But it depends on the specific mental disorder we're talking about.
I'm not surprised you are saying that how we socialize can help build resilience. I noticed that during lockdown, we heard a lot about mental health. It was not easy handling the lockdown, isolation, and all of that.
This is the point I'm talking about, the socialization and
that's
resilience. You see, people were locked down in Ghana, and people were locked down in other countries. But from what at least I saw, anecdotally, it's not any research, it looks like the Ghanaians handled it fairly well. And it's a thing that is there in Ghana. You know, we laugh, everything turns into a joke. True. Very serious matters that people should be crying about it and picketing about, it turns into a joke.
We'll be making fun
of it. And it's one of the healthier ways to deal with stress. Because it minimizes the emotion, the negative emotion attached to the stress. So, fuel prices go up and then the meme starts.
Yeah.
The meme starts. You see, you are still processing the fact that the fuel price has gone up, but it's associated with something funny.
Yeah.
You're laughing about it. So generally, as a society, then it just sort of reduces the amount of mental anguish associated. We're even laughing about doomsday.
Yeah, that's true.
Your light is going off for a day at a time, but it's a joke.
Yeah, things we should be worried about.
Yes, we laugh about it. And culturally, it's helpful in reducing the amount of mental distress that you get from some of these things.
Okay, that's fine. Now, there are lots of things we hear about mental illness that, now that we met you, we want to clarify those ones. For instance, we often hear that people say mental illness is contagious.
Yes.
Is that true?
It's not true.
Okay.
It's not true.
Okay.
No.
So it means, if I get close to someone with mental illness,
you won't catch what
there's no Bluetooth. There's no Bluetooth there. No infrared. Now let me ask this one also. Am I safe around someone who has mental illness if I should get close to?
Okay. The short answer is yes. Okay. Now, in order to expand on this answer, again, I have to remind you about what I said about mental illness and the scope of mental illness. Okay. If somebody is having an anxiety disorder, a fear of heights or a fear of snakes, where is the danger in going next to this person? And this person has a mental illness. Yeah. Somebody who is unable to please his wife and his girlfriend because after 1 minute the action is over. Yeah. He's having a mental illness, maybe having a mental illness, but he's not dangerous. Yeah. So that, I think when we're asking these questions, we have a very specific person in mind.
That's true.
But like I said, it's part of the reason why people don't come to the hospital, because when we say mental illness, we have a very specific image in mind, and it's not the vast majority of people who need mental health service. Somebody is depressed, minding is existing somewhere, sad. Now we're talking about psychotic illnesses, which is what you're talking about.
Yes.
It's like somebody who's having a psychotic illness. People like that, even with them, statistically, they are more likely to be the victims of violence than people who attack somebody else.
Oh, okay.
So because people are afraid of people with psychotic illnesses, they tend to attack them, thinking that they are defending themselves. So the vast majority of injuries are actually suffered by the person who is psychotic, and not the psychotic person causing injury on the other person.
Okay.
That being said, there are some people with psychotic illnesses who, by the virtue of their symptoms, can be violent, but they are in the minority.
Okay. Now, let me also find, I think in our communities around, in our community here, we often see that when people get mental illnesses, instead of their families bringing them to the mental hospital, they take them to churches and other spiritual facilities. But we want to find out, is it a spiritual illness?
Okay. We have no more evidence that it is spiritual than for people with similar disorders like hypertension and diabetes.
Okay.
We don't have any evidence for a spiritual cause for mental illnesses. Societies that are very spiritual and societies whose witches have retired, like the US and the UK, it's very hard to find a witch in those societies. They have the same rate of some of these psychotic disorders and mental disorders. Some of their rates are even higher than ours. So if it's the same disease and their witches have retired and our witches are still active, then it doesn't really make sense to say that it's a spiritual illness here. What we know about it is that whatever the cause may be, there are effective treatments. So people who have the illness should be brought in for the treatment. We have no objection to people going to church, people going to seek spiritual help in these matters or guidance, but it should not supersede taking the treatment that the person needs. So you can pray and take your medicine. There's no objection. But some of the people stop their medicine even when it is working to go to a prayer camp, and then they relapse, and then they have to bring the person back. It's a big problem for us because every time the person relapses, it makes it more difficult to treat the person when they come back. And then the person's long-term outlook gets worse.
Okay.
I know this is not the question you're asking, but an important point is that
get across.
The nature of the severe mental illness, the psychotic ones, like the people are talking about on the streets with the nakedness and the death. It is not a feature of the illness itself.
Okay.
It is a complication. It is poorly treated illness that presents like that. So these very same people, if they had started treatment early and maintained their treatment, they could be lawyers, they could be bankers, they could be doctors, they could be anything, policemen, judges, it could be anything.
Yeah.
There could be absolutely anything. And if you go to the first world, you see them. I even have patients of my own who are functioning at very, very high levels. They started treatment early and they maintained their treatment. What tends to happen in Ghana is that we start the treatment and then some relative or somebody somewhere says that the thing is spiritual. Then they stop the treatment and then the illness comes back. And every time it comes back, it causes some damage to the brain. Every time it comes back, it causes some damage to the brain. So this cycle keeps on going on and on and on, and the brain keeps on getting more and more damage to a point at which even when you've treated the person, he does not look like his former self.
Yeah.
He doesn't talk like his former self. He doesn't function like his former self. And then people come to the conclusion that but it's not a truth in itself.
Okay.
It is from poor management of the illness that you are having this phenomena occurring in this country. If we were to manage people properly, people were to continue their treatment, you won't have that saying in our parlance because they will be working normally.
Yeah.
You know? So it's an appeal.
Yeah. I think it's a good point you're making because usually in our communities, when someone gets mental illness, usually how we even refer to them, this person is mad. I mean, we tag them as if they are useless people, as if nothing good can come out of them. But it's good that you've explained these things to us, and I believe that, or let me rather say, I hope that we learn to treat such ones better. Now, is it curable?
Mental illness, again, it's a broad church.
Yes.
So there are some that will be cured, and there are some that will be managed. So some of the anxiety disorders can go away entirely. Some people can have only one episode of depression in their lifetime. And then there are other things that we manage. So something like addiction. Somebody was addicted to a substance like alcohol or cocaine. It's viewed as a lifelong problem that you have to manage. Okay. So you might go like 10, 20 years without drinking any alcohol or using any cocaine. But the tendency to keep on using once you start will still be there. So we manage the person, but he can live a normal, functional life. With the psychotic disorders, a good proportion of them tend to require management. You don't get a cure. But like I'm saying, if you continue taking your medication, similar to the way somebody with hypertension or somebody with diabetes would take their medication, you can live a full functional life. Just that we wouldn't have cured you, but we would have managed you so that you can go to work, get married, have children, do all the things that you plan to do with your life.
There are some things I wanted to ask, but since you have categorized the types, I think it but let me find out this. I heard of this treatment method, or is a therapy, the ECT, electroconvulsive therapy. Can you tell us about that and then how that also helps in treating mental illness?
So electroconvulsive therapy, it's a very effective form of therapy in which an electric current is introduced into the person's brain. This results in the person having a seizure, a convulsion, the way somebody with epilepsy would. And it's been found that after this seizure, the symptoms of several mental disorders improve. Okay. So it's very effective. It's very effective, and it can often work faster than some of our medications. So it can be used for very severe depression. If you have a bad case of depression with a mother, a new mother, so postpartum depression. the medication might take up to 2 weeks to work, but the ECT can work within a week, so that that mother can return to breastfeeding and taking care of her child. So there are strong indications for it. But because of the nature of it, having to pass an electricity current through somebody's brain and then having to have them convulse before you have the seizure, we tend to limit its use to very, very severe cases. So a very small indication is used for it. But it's an effective form of treatment.
Okay. Now let's talk about the impact mental illness has on society, whether it's social, economic. So let's put all of them together.
Okay. The impact of mental illness, or let's say poorly treated mental illness in society is huge. I can't tell you the number of people who I have managed who are, for example, teachers who are currently working as subsistence farmers or not working at all. We've lost out on that productive line that he could have had in his entire life. It's all gone. And it's again because of this whole, we started treatment and then prayer camp, came back, eventually lost his job, that sort of thing. So, if you follow just this one individual, he has lost his line of work. His family has lost the financial support that he was going to be giving them. Because often they are the most productive, would have been the most productive person in their household. And then his potential wife or spouse too has lost that relationship. Potential children have lost their relationship with their father. The community has lost the services of a gifted teacher. So the social and economic cost, the loss of productivity that we are having in this country due to mental illness is significant. And it's not just the psychotic ones that you can see. There are several professionals who are underperforming as we speak. Their output is less than it should be because of milder incidents of depression or because of this anxiety disorder. You have a very good idea at your workplace that could increase productivity, but the ability to stand up in front of your colleagues or stand up in front of your boss and say, this is my idea, is not there because you have all this fear and all this anxiety in you. It all leads to loss of productivity in different ways. There are several people who don't show up to work or show up late or show up drunk to work. All of this is loss of productivity from mental illnesses. So the impact in society, it's difficult to quantify, but it's significant.
That's a lot. I think from the things you are saying, you've already even mentioned some of the things society should even do to help, like instead of sending them to these prayer camps, bringing them here. Are there some other things that they can do or we can do to help these people?
Yes. Well, the first thing, like you said, I have to mention it again. Once the illness has started, it's important to get the person diagnosed as soon as possible and put on medication as soon as possible if medication is indicated. And the important thing is not to stop the medication by yourself. If medication is to be stopped, it should be stopped with the doctor that is managing the person. We have a process for stopping where stopping is indicated. Start, stop just results in a poorer outcome for all concerned. The other thing that we need is for some empathy, an attempt to talk to the individual and understand what is going on in the individual's mind and deal with them based on what is going on with them. So sometimes the fear is based on misunderstanding. If you are talking to the person, you can understand better why they are doing the things they are doing and you know how to interact with them. If you don't mind a quick story, there was a fellow that was brought into the hospital. He had been tied up wire. He had slapped his mother or beat his mother before they brought him to the hospital. So he's dangerous. So, doctor. I was like, we can't be talking to somebody who has their hands are tied. I need to be able to understand the fellow. So, I let them untie him. He sat down calmly, nice enough fellow. So I was asking, what's happened with your mother? And it came out that he was under the belief that his father had left him, some gold, resources, a treasure. And this treasure had been left by his father all over, let's say, I think it was Accra at the time. So when he's walking in town, then you'll see some of his father's treasure and pick it up. See some of his father's treasure and pick it up. What to you and me is rubbish. Discarded rubber bags, all sorts of, rubbish.
Yeah.
But to him, it is the father, the treasure that his father had left for him. And it looks like rubbish, so that it's his father's trick is to deceive other people. But he can see it for what it is. So when he collects enough of it, his father will transform it to its original shape.
Okay.
So he's packing all of this apparent rubbish in his room. He's packing all this apparent rubbish in his room. He's getting a nice big mouth. The mother is getting concerned because the room is getting dirtier and dirtier and filthier and filthier. So on one of the days he's out looking for his father's treasure, his mother decides to clean the room. She hasn't talked to him about the rubbish. Why is the rubbish in his room? All she knows is that the man bother. And see, there's no sense to what he's doing. So he comes home and the mother has cleaned the room.
There'll be trouble.
Now here's the case where you have about, let's say, 20 million cedis worth of treasure in your room.
Yeah.
And your mother is telling you that she has thrown it away.
Yeah.
Would you even believe her? She hasn't thrown it away, she's stolen it.
Yes.
You understand? So, understandably, the man got irate, lost his temper, and beat the woman.
Yeah.
So they bring him in to me that he is a violent person. But what happened there was that the person he was living with didn't bother to talk to him.
Okay.
Didn't bother to interact with him and find out what was going on. Sometimes, I'm not saying that you should necessarily have to live with rubbish in your house, but you should know that if the person thinks that the rubbish is treasure, it's probably better to bring him to the hospital for treatment before you go and tackle that rubbish. You can avoid an unnecessary confrontation with the individual, and it's for several conditions that it's like that. Sometimes we don't take the effort to talk to people and try and come to their level to understand where they're coming from, and a lot of the friction, a lot of the violence that we get with people who are having mental illness is from this lack of an attempt to even understand the fellow.
Yeah, that's true. That's an interesting story there. Sometimes we hear people talk about the fact that everyone has some sort of mental illness, or we are all. I don't want to say crazy, but I mean that's what people say.
Okay.
To some extent.
So the truth of that statement is that it is very, very hard to find somebody who can be called mentally healthy.
Okay.
By the definition I gave earlier.
Okay.
Somebody who can tick all the 4 boxes, that everything is fine. As I'm tired, I'm sitting here, I'm too tired.
Yeah.
And that is affecting the way I'm processing. I'm not working as productively as I can. I'm not maximizing my potential. Okay. If I wasn't so tired, my output would be better.
Okay.
So I cannot sit here and consider myself mentally healthy. You have an unhealthy fear of snakes, which is letting you leave women. In dangerous dangerous situations. So just between the two of us already now, we've established that none of us can be defined as mentally healthy. Now, like I said earlier, there's not mentally healthy and then there's having a mental illness. So most of us would not be mentally healthy. Most of us would benefit from some interaction with a psychologist or a psychiatrist just to optimize our mental health. But that's not to say we are necessarily mentally ill. Okay. Mental illness speaks to a severity of illness that have a significant impact on your social or occupational function. So your ability to work or your ability to be with your family and friends. So most of us will not be mentally healthy, but most of them will not be mentally ill.
Okay. Okay. So when we started this interview, you spoke about mental health before we even talked about mental illness, and you've explained a whole lot of things about mental illness, some misconceptions. You've really educated us. We are really grateful, but we want to pause here. And then we'll continue with mental health itself. We want to get a lot of information on mental health and how we can promote or how we can improve our mental health. So we'll pause here and then we'll continue.
Okay.
Okay, welcome back, Dr. Marfo Obeng. We enjoyed the first part of this interview where you educated us a lot on mental illness. You spoke about mental health earlier in our conversation. We want to talk more about mental health. We hear a lot of people, we hear the campaign to promote mental health, what you call mental health awareness. Can you tell us a little about what that campaign is really about?
So, just to take us back to what I was saying earlier, the scope of mental health and mental illness is wide, it's broad, it's involving sex, it's involving eating, it's involving personalities, it's involving your mood, whether you are happy or sad, it's involving children that can't sit still, it's involving children that don't respect their elders, it's involving dementia. It's a very broad scope of illnesses and conditions. But we tend to focus in Ghana only on the psychotic, to the detriment of all those other people who could benefit with the help that is available for them now in Ghana. So when you're doing mental health awareness, there's two things that we are generally trying to achieve. We want to broaden people's understanding of what mental illness encompasses, such that those people who need help might be better able to identify that they have a problem that can be helped with, and then allow them to come to the hospital. And then secondly, to deepen the knowledge about the mental illnesses that people are aware of. So some of these misconceptions and that lead to unfortunate outcomes, like this thing we're talking about, where somebody with a psychotic illness is sent to a prayer camp where the medication is stopped. You know, again, we can't stress this enough. We have no objection to prayers and to church and to spiritual guidance, but we do not want it to be either or. If you are taking your medication, we prefer that you continue. You can go and see a pastor. You can get your prayers, but we would prefer it if you continue taking your medication. So some of these things have to be better understood, and then these misconceptions about the outcome of illness, that once an illness starts, the person's life is over, nothing good will come from the person again. Some of these things, we want to challenge them and let people know that no, it is when you don't treat it well that the person's productivity goes down. But if you treat it well, we can maintain a high level of productivity for a long time. So we want to broaden the scope of knowledge when it comes to mental health and mental illness, and deepen the quality of the knowledge that we have about the illnesses that we already know about.
Okay. You earlier explained to us that mental health is different from mental illness, or they are not the same thing. But what connection is there between mental health and then mental illness?
Okay, so mental health, we generally look at that is the gold standard, what we hope for everybody. So that's, like I said earlier, a state of well-being. You are achieving all your goals, you are maximizing your potential, you are working productively, you are contributing to society, you are coping with the normal stresses of life without any challenges. So mental health is the gold standard to which we all want to work to. And then beyond that is mental ill health, where you are not achieving this gold standard, but you are functioning well in your home life and in your work life and in your social life. And then below that is mental illness, where now you are functioning so poorly that it's affecting your home life, your work life, and your social life. So there are degrees.
In your own opinion, from what you've been doing, do you think that people are showing enough concern about their mental health?
I think people may be concerned but not know that they have a problem. Or they have a problem that can be considered a mental disorder, and therefore they can get help for it. I think there are lots of people suffering in silence because they think that there's nothing that can be done about it, and that is their life, or that is the way they are, or that is how God made them, that sort of thing. So I think the concern might not be the problem as much as the knowledge that it is something that they can get help for.
Okay. So, but why do we even need to show concern?
Well, I mean, concern for somebody else's mental health or concern
For our own mental health.
Well, you have to be concerned for your mental health because it affects productivity.
Okay.
As I'm looking at you, I'm not seeing a wedding ring. Maybe it is the girl you ran away from when you saw the snake.
Oh, I have one, but my skin actually reacts. That's why I took it out.
But you see the point I'm making.
Yeah, I understand.
We lose opportunities for ourselves when we don't have optimal mental health. We lose job opportunities. We lose romantic opportunities.
Yeah.
Your quality of life is always going to be better if your mental health is better.
That's true. Now, what are some of the things that affect a person's mental health? You already spoke about stress, like you talked about this thing earlier. But we hear people talk about, I think, in my own opinion, we see some other things that can affect a person's mental health, like social media.
Okay.
Because sometimes I feel that the things that we watch, the things that we see, can sometimes affect, like TV and other things.
So we'll talk about it with the socialization, like I mentioned.
Okay.
Like I mentioned, Ghanaians laughing about things and that being a good thing. Now, there's the other side of that. For people who are at risk, susceptible to some of these things, social media can have an adverse effect, such that people are posting the best shots from their life. Okay. They are posting a life that they don't actually live, and then you are looking at it on your phone and comparing yourself to that impossible standard. The family that is happy all the time, the children that are only getting good grades in school, then you are looking at your own existence thinking, where did I go wrong? That sort of thing. So if you are susceptible to some of these problems, it is likely to accelerate or unmask some of these problems and give you a significant challenge. Some of these, I forget which islands about, the Pacific Islands. They had no recorded anorexia. That's this disorder where people don't want to eat because they believe that they are too fat, even though they are very skinny most of the time. Now, they had no recorded cases of anorexia until Western media was introduced to them.
Okay.
So the disorder did not exist until the Western concept of beauty being skinny was introduced to the people. Mm-hmm. So there are certain disorders that go with certain social activities. So like you're saying, what you're watching on TV might have an impact. What you're looking at on social media might have an impact. But there are simpler things which people don't give enough attention to. Sleep.
Okay.
Whether or not you are getting enough sleep, enough quality sleep at night, giving yourself time to sleep. That's where the TV thing might be more relevant, because you are watching TV, you get to bed like 1, you wake up at 5 to leave again. You're not giving your body, your brain enough time to rest and recuperate before you start the next day. Your likelihood of developing a mental disorder goes up significantly. Exercise. The more you exercise, the more healthy you are mentally, the less likely you are to develop a mental disorder. And exercise is good, but exercise in groups is even better.
Okay.
So social exercising, football, basketball, volleyball, netball, a game that involves other people, it's very good for your mental health. But if you can't get a game that involves other people and you are just even jogging or walking by yourself, even that is good for your mental health. And then your diet. A diet that is rich in fruits and vegetables, a healthy, balanced diet is also good for your mental health. So we tend to talk about these interesting things, social media, but these 3 things have a more significant impact on the quality of your mental health than any other thing that you might be talking about.
Okay, I think these are areas where we need to pay close attention to. I think in the first part of our interview, you already spoke about how a child is also handled, that can
Yeah.
also.
Yeah.
So I won't even mention that because you already talked about it. And then now let's.
If you don't mind, I'd just like to
Okay.
mention one or two things. Children having a stable adult role model,
Okay.
adult person in their life, helps them be resilient against the development of mental disorders. So if you have a child that is having people going in and out of their life, in and out, in and out, in and out, they are less likely to have the resilience against developing a mental disorder. Children who are given responsibilities, so you, it's your job to sweep here, or you, it's your job to take care of A, B, C, and D, they tend to develop, have more resistance to developing mental disorders. So the way we raise our children, children who are raised in two-parent home tend to do better than children in one-parent home. So the way you raise your child can either increase or decrease their risk of developing mental illness later.
Oh, okay. These are things that we don't often hear. It's good that you are telling us. Now, if I feel that I have mental health issues, or I'm developing a problem, who do I talk to? Where do I seek help?
Well, it depends on where you are.
Okay.
The ideal thing is that you would go to and see a psychiatrist or a psychologist. So in the psychiatric hospitals, our doors are always open. You don't need a referral before you come to a psychiatric hospital. So you can come, you might talk to a psychiatrist, or you might talk to a psychologist. All the teaching hospitals have mental health wings with mental health professionals in them. And currently, so every district hospital has a mental health unit, so that you can go to the mental health unit and you might talk to a psychiatric nurse who might be able to help you with some of your problems. So district hospitals, regional hospitals, teaching hospitals, psychiatric hospitals, whichever one is most convenient for you, you can get in touch and have a chat.
Okay. Dr. Marfo Obeng, you've helped us see that we don't have to wait until it gets so serious before we seek help. And I'm sure that that is exactly what we'll be doing. And now that you are stressed, we don't want your mental health to be affected so much. So we'll end our interview here. We thank you so much. We know that you have a busy schedule, but you made time for us. We really appreciate it, and we appreciate the information you've given us. You've really taught us a lot. You've taught us a lot. Thank you so much.
You're welcome.
So we'll leave you so that you can enjoy the rest of the day.
Thank you.
Okay.